in Cameroon. I've been very impressed in my short time here learning about the impact that CDC is making. And I think that impact is only possible because of the amazing staff that have made that impact possible, the people who are behind the impacts, the partners who are behind the impacts, the various interventions implemented by this team here at CDC in close collaboration with the government of Cameroon, with many, many implementing partners, with civil society, working with private sector to make that happen. Very impressive. We're talking an impact of less than 60% of people knowing their HIV status to now what we think is more than 90%. That's huge. Beyond that, the number of people who know their status and they're actually on life-saving treatments. We've seen great improvements there.
Grâce à CDC, grâce à cette coopération qui s'est mise en place au fil des années et qui est montée en puissance au fil des années, nous avons, sur le plan de la détection et de laboratoire, pu mettre en place 45 laboratoires capables de faire la détection de la COVID-19, mais aussi des autres germes impliqués dans les problèmes de risque d'épidémie et de pandémie. Nous avons implémenté la surveillance génomique, ce qui permet maintenant d'être plus affûté au niveau de la surveillance. Nous avons pu aussi, grâce à tout ceci, améliorer la coordination. Le grand bâtiment du centre des opérations des urgences a été construit.
When we usually talk about what we've accomplished, we talk about the reduction in child mortality. There's been a significant reduction on child mortality, about 34% in our fact sheet specifically. Seasonal malaria chemoprevention is our flagship activity. We've provided technical assistance to ensure quality implementation of the seasonal malaria chemoprevention.
Best thing I ever did in my life was launching the Field Epidemiology Training Program. So this was launched in 2010 together with the Ministry of Health. And the Ministry of Health really took on this program. This program now is really the basis of a lot of other activities. So a Field Epidemiology Training Program means that we are training Ministry of Health staff and staff from the Ministry of Defense, Police, in field epidemiology.
Basically, what I do is I work very closely with the Ministry of Health and the National TB Control Program, providing them technical support. It could be in policy, developing and advancing policies that address the gaps that we are seeing on the ground, but also that address quality services which should be provided to clients. I also work very closely with clinical implementing partners, providing them guidance, orientation, and we do a lot of traveling as well to go to the health facilities that we support, to be able to work with site-level staff, provide them mentorship, coaching, training, but also trying to understand the challenges that they face.